Brazil is the latest country to approve new generic GLP-1 drugs to treat diabetes and obesity. Now, Canada and India have now done the same. Drug maker Novo Nordisk's semaglutide patents have now expired in these countries. You see them there. The generic drugs are expected to be much cheaper than brand name Ozempic. They're also expected to push Novo Nordisk to lower its prices where generics are available. Tahir Amin is the CEO of the Initiative for Medicines Access and Knowledge. His group is calling for drug patent reform. I have to comment that this has been going on for decades, right? I'm going to deal first, with what it means to have these generics on the market right now. So can you speak about the transformative nature of these drugs, the fact that they have the ability to transform whole societies that are in need of these kinds of drugs, and why that's important?
Absolutely. These drugs have changed people's lives, from weight loss to basically treating heart conditions. And there's so many more uses that these drugs could potentially have. And the fact that many Americans in particular, and also Europeans, because they're still under patent in those regions and countries, is they're not going to be able to afford these medicines, at least until the patents come off, which is likely to be 2032. So many Americans particularly are not going to be able to access these medicines. And the statistics show that. I think over 50% of Americans who are taking these GLP-1 drugs are saying that they're finding it difficult to afford them. And that includes people under insurance too.
And so your point for these drugs, this class of drugs, is the fact that they are too important to leave these patents in place. You believe there should be more access, obviously.
Well, I think patents play a role in getting the development of these drugs into the marketplace. They can do that, so I'm not going to deny that. There is that incentive. But I think what we have in the United States, and I'm going to just focus on the United States, is we have policies in place that extend these patents by 5 years. These are policies that were crafted in the 1980s, lobbied for by the pharmaceutical industry under this idea that there would be some balance in allowing generic competition in, but then we would actually give these pharmaceutical companies, the branded ones, a bit more time to extract further revenue to compensate them for any delay in regulatory approval of their drugs. But when you're talking drugs of the revenue sizes that these GLP-1s are amassing, it's kind of astounding to see what an extra 5 years of patent protection can provide, let's say, for a company like Novo Nordisk. My organization has done studies on this, and just in those 5 extra years, Novo Nordisk will earn in revenue approximately $146 billion. And that is all money that is not going towards helping people get access. That's going to shareholders, dividends, and it's all at the expense of patients who are not able to afford these things. And more people are either trying to find compounding outlets, and that's raising a whole number of issues.
But your argument is a familiar one for so many classes of drugs. So I'm wondering, what gives you optimism that you're going to be able to change this? Because as I say, other people with other classes of drugs have tried this for years and have been unable to move the expiry of these patents.
So I think Congress is finally starting to see the role that patents play in denying people access. It's how it's shaping competition in the marketplace. I mean, just last week we saw a bill that was passed. It's not the greatest bill, but it's a start in a long process that has been happening over the last 6 years, where it's a bipartisan approach. Both sides of the aisle are now realizing that we need to tackle the patent system if we are going to lower drug prices. Take a drug like one of the best-selling drugs, Keytruda, the cancer drug. I testified at a hearing at the Senate Help Committee, and there's been a follow-up to that where a lot of senators are asking the question is, how come someone like Merck is going to be able to hold on to the marketplace for much longer than their underlying patents suggest? And these are questions that are being asked regularly now, including yourself in the media. And that, I think, has shifted the landscape in terms of addressing patents. You're right. Over the last 20 years, the question of patents has always surfaced. But I think we're in a different phase now where I think the evidence really is showing, and the hardships affecting Americans is really telling.
Yeah, and your message is clear. If you want those generic GLP-1s that they have in other countries, call your lawmaker, whether you're in the United States or Europe. That'll likely have the most impact. To hear, I mean, we have to leave it there, but we'll continue to follow this story. Appreciate it.
Thank you.